Welcome back to Morning Express on this 23rd day of November 2016. It's time for your health. And this morning we'd like to talk about functional dry needling. And to have that conversation with me is Dr. Hamisi Kote. Welcome and thank you for joining us this morning.
Thank you so much.
Dr. Hamisi is a chiropractor. And maybe just to understand, first of all, what does a chiropractor do?
First of all, let me define what chiropractic is. Chiropractic is a science, art, and philosophy in medicine whereby we use our hands to correct spinal misalignment that we believe cause a dysfunction that end up resulting in disease, be it back problem, be it neck issues, be it some of things like torticollis for kids, ear infection, and stuff like that.
Okay, so basically you don't use much of medicine. It's mainly your hands.
It's my hands, yes.
Okay, and now when you talk about functional dry needling, I get the impression that we're going to have needles.
That's right.
In the house.
That's right.
Okay, and these needles, do they cause pain?
Like in any other treatment that you get, most of the time when you prick the skin, there's always the initial pricking pain, which is very slight because the needles that we use for dry needling are precisely very, very thin. And therefore, they cause very little sensation of pain when you're pricking them. The other thing that is about needling is when you do functional needling is you get into a densified area or area where forces of muscle contraction don't glide properly. And when you put a needle there, you get something called a twitching response. A twitching response is whereby it's like a muscle twitch or like a small muscle cramp inside the muscle. Basically, that's what mostly people feel when you do dry needling. Okay. At times, you don't feel anything.
Okay.
Yeah.
And we have Jacob here who we're going to come to in just a bit. And Jacob basically is ready for the treatment. So we're going to be doing that live right here as we go along. But Daktari, what's the difference between dry needle, what we're talking about here on dry needle and acupuncture?
The two are based on they're two different things, but most people end up confusing them. Acupuncture is a Chinese traditional medicine, and dry needling is Western medicine. So what do I mean? For you to do acupuncture, you have to be trained in Chinese traditional medicine. So you have to go to a school that teaches Chinese traditional medicine, that is acupuncture. On the other hand, dry needling was developed by a medical doctor by the name Janet Travell and David Simons. These were physicians for J.F. Kennedy. So what they did is they realized some points in the body where you have muscle densification. You can use a needle to break that densification and get the same relief that you'd get if you were to inject a drug into the muscle. And that's how dry needling came into being. So it's based on a lot of palpation, a lot of functional testing, and on muscle movement restriction.
Okay, so how does it work given that you're not injecting a medicine into the area that has discomfort or pain?
Our body is in itself have enough power to heal itself. So what happens is that when you introduce a foreign substance into the body does a reaction. And when you get that reaction, the body produces enough chemicals that are used by the body for its own defense mechanism to relieve pain. So in this case, when you put a dry needle on a densified area or that area where the forces are not transmitting properly, then you cause a reaction or an inflammation. That inflammation makes the body to react. And when the body reacts, it sends in chemicals. For example, it sends in painkillers that the body produces on its own. And that's how you end up relieving pain using dry needles.
Okay, so now with dry needle therapy, if that's what it's called, do you get instant pain, or is it something that needs to be done over time and then the pain is relieved or the discomfort?
Dry needling, it's one of very interesting treatment. Most of the time you get almost instant relief with the symptoms that you have. You may feel some bit of soreness because of having been pricked by a needle. It may last for a few minutes, it may last for an hour, it may last for up to 12 hours. But it depends. Different people react differently. So it depends on him and someone's body. But most of the time, it's very, very quick relief that the patient gets. Yes.
Okay, and would you say that how accurate is it in terms of relieving pain? 100%?
It's 100% depending on it all depends on the on the efficiency and the accuracy of the therapist or the clinician who does the assessment and treatment of the patient.
Okay.
Yeah.
Well, I like to get into the crack of things. So maybe you can first of all find out from Jacob where his pain is and maybe just guide us through what is happening. So yeah, take over, Jacob. Maybe you can explain to Daktari your...
The way we started is, first of all, I like to know a history of what happened. Just a brief history on what happened and what has brought you, or what is causing you pain. That's where I would start before you do an assessment.
Okay, I actually fell down the stairs and kind of laid on my ankle. Yeah. Now, I slept on this side, and from that day, I felt pain towards this direction, from the ankle up to the knee joint.
Okay.
Yeah.
And when was that?
That's like 2 months ago.
Did you seek any treatment?
I was just massaging.
Okay. Right now, in a scale of 1 to 10, how would you rate your pain?
I'll give it an 8 over 10.
An 8 over 10?
Yeah.
What is it that you can't do because of the pain? And if we treated today, we can use it as a test to confirm you feel better.
I can't run fast.
You can't run fast?
I can't run fast.
Okay.
And sometimes I can walk fast, but then get stuck in the middle due to that shock pain.
Can you jump?
I can try.
Is it painful?
It's painful.
Okay, let's try and see.
You want him to jump and maybe, yeah, go on.
Yeah, jump out, and if it's painful, tell us and give us a grade. 0 to 10, 0 being nothing, 10 being maximum.
Like how many times?
Just jump like that.
So I can't step with
That's
this.
the
Yeah.
Okay, I think that's good enough for what we'll use as a test.
Okay. Yeah, and I noticed when he's jumping, he's more or less landing with one leg.
With one leg.
The other one is more of just support.
Yes. So the next thing I want you to do for me is, I want you to go up on your feet. And let's go. Is it painful?
A bit painful.
Quite painful.
That much.
Okay, let's go here.
I can't do that.
You can't do
I
that?
can't do that.
Okay. And can you do this?
No.
No. Okay. Can you do this?
It's painful, but I can do it.
Oh, but it's slightly painful.
It's slightly painful.
Okay, where do you feel the pain?
I feel the pain on this joint. Towards the knee, towards this joint. Yeah, and sometimes the pain elevates towards my ankle.
Okay.
Yeah.
The other thing I want you to do for me is you step on this part of the foot, this part of the foot, like this.
Yeah. If I step on this part of the foot, I can feel the shock here.
The shock.
Yeah.
Okay. The other thing is I want to put my foot here, and you're going to push it. You're going to push it in that way.
This pain.
Okay.
Yeah.
There's the other side.
No, there's no pain.
Okay.
Yeah.
Lastly, just do for me a squat. This.
Is it?
Yes. Is it painful?
It's not painful.
It's not painful.
It's not painful.
Okay. Let me have you here. You can lie facing up. No, the other way. Yes. I'm going to touch several spots along this portion.
Yeah.
I want you to tell me if I touch something very painful.
Okay. There's pain there?
There's pain here.
Yeah.
Okay. And then I wanna have you just slightly turn the foot like that. Do this. Let go.
There's pain?
That's painful.
Yeah.
Is it sharp?
Slightly short.
Okay. Is that painful?
It's painful.
Okay. But go behind it a bit. Is that painful?
Not that much, but it's painful.
Turn.
So basically, Daktari, as you're doing that, what exactly are you...
What I'm doing
looking
is
for?
I'm assessing the muscles that control the movement that we have tested and it's painful.
Okay.
And that is the ankle
So from the
movement.
test that you have done, you're able to establish roughly where the pain is and what muscle.
And what muscles are involved, and those are the spots that we're going to do the needling.
Okay. Jacob, so you can turn over. And
The other way, on your stomach, please.
On my stomach.
Remove your glasses.
just in case you scream and shout and throw your glasses off, we don't want to pay for that, so just joking. All right.
Okay. And you just need to relax. Is this painful?
Yeah, it is painful.
Okay. I think I have what I would thought.
Okay, so what have you found out so far?
What is happening is that the muscles that do this, it's densified both here. The muscles that does that are also densified in the front. The muscle that does this and this are also densified. So we need to needle those spots and then test.
Okay.
Yeah.
So needling here means literally putting needles.
Yes.
This is the point where you don't look.
But before I do that, I need to have his consent. I need to have your
okay.
consent to be able to do this. Is that okay? So you don't have to fear. There's no danger of hurting you when we're doing the treatment. The only thing you expect is that twitching response that you're going to get, or something like a burning sensation. There might be a referred pain or referred sensation to where you feel pain. So that's a good thing. Okay, we're going to keep the needles maybe for about 2 minutes and then we'll remove them.
Okay. So do you have different types of needles?
Yes,
That you do this?
we have different sizes. Or if I may show them, all depends on what we are treating. So
Okay.
we have what we call 75. It's for the big muscles like the buttocks. That is a 40 or a 50. This is 75.
Okay.
This is a 25. And this is a 40.
Okay.
This is a 75.
And these are
This is
the
100.
needles. If I can just show them. These, you call this 75. And I'm assuming 75 here is the size.
And this is the 100.
That's 100, okay. 75 right there. Just hold that camera right there. Let me do 100, and that is 100 in terms of the size of the needle.
So maybe
Okay.
I can just explain. For the
Okay.
bigger needles, we use on the bigger muscles, like on the buttock muscles.
Okay.
For the small, for the 75s, we can use them around the buttocks or in the hamstrings. When you're working on the chest cavity, because of the issue of the lungs, you use the smaller one, the 25s.
Okay.
When you come down to the feet again, it's small muscles, so you also use small needles. So the size of the needle doesn't matter. It matters on where you want to work.
Okay.
So it is always dictated by where you want to work.
Where you want to work, okay.
Yeah.
And just maybe to find out, when you talk about the size, are we talking about the diameter, the size in terms of how
The size
big it is, or is it the length?
It's in two ways. If you look at the needle, has two measurements. There's a 0.30
That's
times 75.
okay.
So 0.30 is the diameter, times 75 is the length.
Okay. All right. I'm sure Jacob can't wait to get this over and done with. So let me allow you to do that. So basically just cleaning. And you've already identified the muscle that you want to...
It's very, very specific. You identify the exact spot to put the needle. So I've already done that. It's not
You've
just
already done that.
Yes.
But you didn't put any marking or any...
No, I don't need it because I already know where it is.
You know it is.
Yeah.
Okay. And is that a skill that you develop over time, or is it something that you're taught that you can actually identify exactly where to put the needle?
You're taught, but most of this treatment is it's a practice.
Okay.
And the more you practice, the more you get familiarized with the treatment, the more then you become almost
Good in it.
Good in it.
Okay.
Yeah.
All right. And for how long have you been doing this?
I've been doing dry needling for the last 5 years. I've been practicing as a chiropractor for the last 3 years. And I've been a physiotherapist for the last 15 years.
Wow. Okay.
Yeah.
So you have a wealth of experience, definitely.
Yes, I have.
All right. Go right ahead.
Okay. The worst spot there or up here?
There.
Up there. Okay. So these needles are always sterile.
Okay.
And they are one use. Okay. That's already
Well,
in.
it's all gone in.
Yep. This one? Painful? This one?
Oh.
Is that painful? Okay.
And so far, Jacob, you're feeling?
Anything there?
That's painful.
Anything there?
No,
Anything there?
not really.
Anything there?
Yes.
There, right? And then the next thing you do is we normally have to twitch the needles,
Okay.
because you're needling the fascia. Fascia is the connective tissue that envelops the body. So the needles have like rough edges on them. So when you turn them in, he can tell you can't pull it out.
Or you can't?
No, when you turn it in, you can't. So you have to unwind, and then you get it out.
And interestingly, I don't see any blood. Is it that this guy doesn't have blood or what?
Normally when you do needling, it's very rare that you have blood.
Is it because they're that thin that
It's
they don't
because
actually
of the,
draw
it's
blood?
because of the size of the needle, yes.
Okay.
Although some places like this one was very tight. This one sometimes may give you a drop of blood, but no. Okay.
Actually, there is no blood
So
whatsoever.
let me have you turn and face up. Okay. Now I have again to clean on this other side.
Again, so now those few seconds that the needles were in,
It's enough.
what do they do?
Already you've caused an inflammation. So when you've caused an inflammation, the body senses something foreign has been inserted in it, and as a result, it sends its soldiers. And the soldiers now are the various chemicals that are sent to go and check what is that, where is that injury, and when you do that, is you allow now the muscles to start grinding. Because after you have done the needling, you need to go now to the next stage, which is now you do some stretching, you do some rehab work, so that now the muscle grind goes back to its normal position.
Okay, so in other words, what you've done with those needles is that you've provoked a reaction in there.
Perfect.
They felt some foreign body, so they've had to react in a way.
That's right.
Which is what medicine ideally would do?
Yes.
Okay.
Yes.
All right. And somebody's asking on Twitter why you don't have gloves.
Well, when you're doing dry needling and you're doing gloves and you have to palpate, there's a lot of cumbersome. You can't be very precise, and you don't want cases where you also prick yourself when you're pricking the patient. So you have to be very. You have to have your hands clean in the first place. You have their hands sterilized, and then you do it. When you do it with the gloves, it's very, very cumbersome, and you can easily prick yourself, or you can easily, as you do it, end up not being able to palpate areas where you want to do it.
All right.
There.
No.
There?
No.
There?
Yes.
Okay. Okay. The other thing I want to do, I want you to turn your foot like that.
Jacob, what are you feeling right now? Is there like excruciating pain? Is it just discomfort?
When he's breaking it, there's no pain that much, but when he leaves it there, there's a little bit of pain, but it doesn't last for long.
It just comes and goes.
Yeah.
So when he's actually driving it in, you don't feel the
I
pain?
don't feel anything.
Wow.
And then I want you to turn your foot like that. And do a smaller one.
And Daktari, right here now we are working on a pain that's on his ankle. What other areas can dry needling work in terms of relieving pain?
Anything from the foot to the head. If you come to me with sinusitis, for example, and you're having blockage of your sinus, I can use the needle to treat you. When you come to see me with a clicking jaw, I'll be able to use to treat you. When you come to see me with a ringing in the ear, what we call tinnitus, I'll be able to use this. If you come to see me with a neck pain, I'll be able to use this. If you come to see me with shoulder. So anything that affects the skeleton system, movement and function, it's fair game.
You're able to?
Yeah.
Okay.
Yeah.
Now we...
Anything there?
No.
Anything there?
No, go down,
There?
a bit down. Yeah, there.
Okay. And then I'll check one more spots around here. Anything there? Anything there? Anything?
Down, go down. Down a bit. Right there.
Still low. Right there?
Yeah.
Okay, so we just leave the needle for just a few minutes, and then after this we'll move, do some stretching, and then test it.
So ideally, this should actually relieve the pain that he has on his ankle.
Yes.
And that's based on the muscles that you already identified
Yes.
that take care of that.
That movement.
Should he be able to do what he was not able to do?
Yeah, he
Fully?
should. He should be able to do. He should be able to. We're gonna test and see.
Okay.
Then when we test and see, we'll see is there anything here. If there's nothing here, then we don't need to do anything else.
Okay.
If there's something here, then maybe I'll do a needle here or needle here, and then that's it.
In a case where, do you have cases where maybe you've not had any success whatsoever?
Absolutely, like any other medical treatment or any other medical technique, the success varies on individual to individual. There are people who react well to Panadol. There are people who don't react well at all. There are people who react very well to needling. There are people who don't. So it all depends on, as a clinician, what do you come up with? What do you find? And what do you think is the best medicine for the patient at the time?
Okay.
Yeah.
And now this, of course, is not our traditional kind of medicine. It's not something we're used to. You can't walk into just a hospital and have a acupuncture or dry needling done. It's a specialty.
Actually, I'm the first person to start doing dry needling in Kenya, and I'm the first person also to bring dry needling instructors from the US and from South Africa to come and teach. So abroad, this is the norm. It's a big practice. For example, in the US, in Australia, in the UK, Europe, is huge practice. There are people who only survive on doing dry needling. It's a changing trend from the normal physiotherapy where you just go and have hot pack and ultrasound and a TENS and massage. This is very, very different. It's very, very precise. And it's a new way. It's a new way of looking at how quick do you fix problems that people present with to you to the hospital or to the clinics.
Okay. Do you feel the pain as they're being withdrawn? Okay. It's one that I must say you need guts to even watch, because just to think of that needle, how deep it is a bit disturbing. Interesting, though, that there's actually not even a single drop of blood. It's all...
Okay, come up. I want you to go here. Okay. Like this. No, we're not going to bend the knee. Just moving the ankle. Yeah, step on that. Now make it slow. Then back. Make it slow again. And back. Make it slow. Back. Make it more even slower, 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 slower. All the way to the heel. Again, yes, again slow. Okay, now let's go here. Any pain? Apart from the needle discomfort, any of your pain before?
Not that much. A little bit of pain.
Okay, let's go here.
You were not able to do that before, right?
Yeah. So what I can feel
Mm-hmm.
is just the needle. So where the needle's pricked, I can feel some discomfort,
But not your pain.
but not really pain.
Okay,
Yeah.
let's do this. He was not able to do that, remember?
Were you able
Yeah.
to do that, Jacob?
I wasn't able to do this, but as much as I can do it, I can still feel pain from this joint.
How much?
Not that much.
Okay,
but this
we'll look
pain.
at the 2 points I told
Yeah.
you. Okay, the other thing I want you to do is this. Let me have you back here.
On a scale of 1 to 10, Jacob, how would you say you're feeling now compared to when you did those tests initially? Are we halfway? Are you still, is it still the same? You can be honest.
Actually, it's not the same. Honestly,
Worse,
it's not the
better?
same. It's a little bit it's improving a bit, yeah. But at the ankle joint, there's still some pain on this other side.
Okay.
Yeah.
On a scale of 1 to 10, improving?
I'm improving. I can give it an 8 over 10.
8?
Yeah.
Wow. Before we've even finished. Okay, now this is the part where I can't watch because
This one?
Not
it
really.
just is something.
Yeah, there.
I don't know what it is about us human beings that you don't want to see somebody, putting a needle right there. So I'd rather not look, but I can look at it after. And that needle, just to give you an idea, it's about, I'd say what, an
Yeah.
inch?
No, not there.
Yeah?
Actually, the pain is just
About,
around.
Yeah, but
inch.
any discomfort here?
No.
Worth of a needle that's literally going into his skin. However,
Nothing
yeah,
there.
No,
you can
nothing.
actually see that now. If you can
Here?
see, right there. And
Yes, there.
I'm not
There.
sure you'll be able to see the needle going in there. You go. It's about an inch. Ooh, that feels uncomfortable for me who is watching. I'm not sure about Jacob, but there you go. About an inch worth of a needle going in. How do you identify those points? Is it a specific nerve ending or is it just an area,
no,
general area?
The body is divided into 3 planes of movement. Bending forward, bending backward is one plane of movement. Sideways and sideways is another plane of movement. Rotation, another rotation is another plane of movement. So 3 plane of movement gives 6 movements. Now, these 6 movements are what controls everything that we do. If you don't have the 3 planes of movement, then you cannot be able to function 100%. So my interpretation is, what is it that he can't do? Okay. And what is limiting him from doing that? Within, and which plane of movement is affected?
Okay, so that helps you identify the muscle that does that.
Exactly,
Okay.
and then what to treat.
All right.
This one?
Move up a bit. There.
This one?
Yeah.
Okay, I'm told we only have 4 minutes to go. And
Okay, I'm gonna be done. I'm gonna be done with this one.
yeah, so
This one?
as you
Not
can
really.
see that
This one?
No.
we started off
This one?
with
No,
him not having,
This one?
or rather having pain on the ankle. And according to Jacob, who is one of us who works with us here, he has improved from
That's
0 to 8. On a scale of 1 to 10, it's
That's
8.
the same movement as
So
those
we've
two.
had him
And then you-
given needles, but there you go. Let's have him now out of hospital.
Maybe we can, you stretch a bit, and then we can do the jump. Can do this. Okay. Now let's test the movements, and this was the most painful, and this one.
Pretty much, it's good. Yeah, you can do it.
Okay, let's go here. Harder. 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 Yeah, that's it.
So, Jacob, your assessment of the dry needling?
Can I give it a rating?
Yeah, I need you to give it a rating. We need to know whether you're in more pain now than before or less.
Actually, there's only discomfort from the unpricking of the needles. But then again, I feel some relief. Yeah, there's some relief. And I'm not sure about the knee joint because I haven't walked yet. But if I walk, I'll know.
What if you sprung? You said if you had. So do it.
If I do,
Yes, go.
If we had more time, we'd probably take you out to the garage and have you literally do a sprint and maybe even race with the Daktari. But Daktari, he also had a pain on his knee. Did we address that, or were you mainly
We did.
addressing the ankle? You did?
We did, because the muscles that I needed, I worked on in the first place. Some of them control both the knee and the ankle.
Okay.
Yeah.
All right. And Jacob, on a scale of 1 to 10, where would you rate it right now after the second session?
9 over 10. because I can feel at least I can do this. I couldn't do this before. Yeah, because when I could before, if I could do this, I could feel some sparks. Rather, can I say that?
Like pins and needles?
Yeah, exactly.
Okay.
Yeah.
All right. Thank you very much, Daktari. I think we're out of time. And maybe just to let you know, this is Dr. Hamisi Kote and is reachable at Hamisi_Kote. Maybe if somebody wanted to get in touch with you, where would they find you?
Our office is located in Parklands, Premier Rehab Centers. Telephone number is 0713-030-395 or 7.
All right, thank you very much, Daktari. Thank you, Jacob, for being the guinea pig this morning and for allowing your body to be pricked for us to have that as a demo. That's where we're going to wind up Morning Express this morning. Thank you so very much for staying with us right here on Morning Express. This is where we call it a day from a very dedicated team that ensures Morning Express comes to you every single morning. We say a big thank you for watching us. Do stay with us. We've got Worldview coming up next.